Governor for Morobe.
Thank you, Mr. Deputy Speaker, for giving me the leave to ask questions not on notice. But before I raise those questions, I'd like to thank the Prime Minister, Member for Tari, and his NEC to give it okay to the Australian Prime Minister to address this Parliament, which is exclusively by Constitution reserved for the members of Parliament of Papua New Guinea. I want to thank you on behalf of the Morobe people that you brought him. It is the Labour Party of Australia under the leadership of Gord Whitlam and his government which granted, which sanctioned and which gave the okay for this, the territory of Papua New Guinea as it then was, to acquire political independence. And it was working with the Pango Party, the first party of Papua New Guinea, to make sure that we acquire the political independence. And it's only fitting that the Pango Party leadership, with your leadership as the leader of the Pango Party and the government, to make sure that the Prime Minister of Australia addresses this Parliament. And I want to unreservedly thank you for historical event that occurred, but very good historical event that occurred for the betterment of Australia and for Papua New Guinea. Mr. Deputy Speaker, I rise to ask a question to the Health Minister. Mr. Speaker, Health Minister, the topography of Morobe is such that it's very difficult to construct in a speedy way roads to every corners of Morobe. And the seas of Morobe are very tough for the boats and the ships to get to the destination smoothly. And people are right in the locations where their ancestors have lived in the time immemorial. And they're not like New Guinea table beds that we're going to get them and bring them to town. Not at all. They're human beings. They want to live in those areas. And Mr. Speaker, Deputy Speaker, it's very difficult to bring medical services to those areas. As it is now, the Papua New Guinea's doctors, national doctors, with the greatest respect to them, they're not inclined or are not much willing to get those to the difficult areas to provide medical services. And we will require in a minimum level to get to the general hospitals. In the Morobe province, we have a couple of general hospitals. Eteb General Hospital, which is in the TVWAN Siasi district, Butaweng Hospital in the Pinsapen district, Bulolo Hospital in the Bulolo district, and Mushin in the Deputy Speaker's electorate, Makam, Mushin. All those infrastructures there in those hospitals are in order to enable the doctors, qualified doctors, to come to those areas and save the people. We are in a dire need of medication. We are in a dire need of dealing with sickness we cannot handle. It's not just like malaria. It's not just like pneumonia. There's some sickness which requires doctor to be present to diagnose, to find out the diseases.
Honourable
now,
Governor.
In this country, we are in shortage of IC as a country. So I'm asking you, Dr. Minister, my question is simple, but it's a very important question. Whether you like it or not, it's very important. That question is, can we get the foreign doctors coming in to this country? There are countries like Philippines who got abundance of doctors. There are countries like Brazil which got abundant doctors, qualified doctors, doctor of medicine. in India, Sri Lanka. Those countries, doctors are qualified, they're looking for jobs. We need doctors. And I'm asking you, Mr. Minister, can we get the government approval? In the province, I will make sure, I'll step up 100% to make sure we achieve this mission, is to deliver doctors to the Morobe province first. Then in other places, in the same scenario as the Morobe province, we can deliver. But we need overseas doctors now, whether you like it or not. You don't bargain with your life, doctor. Nobody bargains for your life. You sick, but you die, and by you die, yeah? You like talk on God, like give him life, play you back him. No, I'm making this finish there, you. But we were entitled to live longer, and doctors will enable us to live longer. Thank you, Mr. Doctor, and thank you, Deputy Speaker. Me ask him, please, too, yeah, you are him.
Thank you, Governor. Honorable Minister, before I ask you to respond to the Honorable Governor, honorable members, me like Toksavelo House, suppose one member, sanab na ask him question, you know can walk about past loem, time me ask him question, I need lo standing order, blow you me lo floor, but you must wait in up MC down, na behind you can walk past long I'm just the Toksavelo House. The Honorable Minister, you can respond to the question of the Governor.
Deputy Speaker, thank you, Drew. I think, first of all, let me thank the good Governor for Morobe, Honorable Wenge, for this important question. Suppose you look him under the explain when we put him out. Health workforce, I'm #1 priority, or this list where we put him out. To put this question into perspective, let me just give you a couple of figures. In this country today, we have about 602 doctors. The normal accepted ratio for a doctor to population ratio set by WHO is 1 to 1,000, 1 doctor to 1,000 people. Right now in this country, we have 1 doctor to 17,000 people. Now the medical school that we have in here in this country has been producing a constant number of doctors. It hasn't gone past 60. The numbers have ranged between 50 and 30 over the last how many years. Now if you look at the population has been constantly growing. So therein lies our problem. We have a population that's growing out of order, and yet we have a constant number of doctors being produced every year. Now to make matters worse, we had about 50 doctors who stood for elections in the last election. To bring them on board on short-term contracts is actually taking a bit of time. Now we plug in this big problem where there's about 1 doctor to 17,000 people, so that problem is not only peculiar to the Morobe province, it's actually a problem that's affecting all of the country. Now you are proposing some good ideas there in terms of bringing in doctors, because we don't have the numbers to actually cater for our population. We need to look at some short-term measures, and one such short-term measure is to look within our region and find doctors who are competent, who are compatible to the system that we have in this country. Because there were some propositions in the past where they looked at bringing in Cuban doctors and all that. There's some Cuban doctors who were brought to other Pacific Island countries, but there seems to be a lot of problems in terms of their competencies. So, we're a country, and we have our standards, and doctors that we bring into this country must meet those standards as well. That's where the medical board comes into play. But the bigger problem we have is funding. Now, we can't source those help because we simply don't have the money to bring them on board now. So the government is looking at some short-term measures, also is looking at some long-term measures, and one such long-term measure is to increase our capacity so that we can produce the number of doctors that we need in the country. So wisely, the government has actually given the direction to our university to actually allow medical school to become a university of its own so that it can, with that, increase capacity so that we can also increase the number of doctors. We've also allowed another school from Medang to come on board to actually help out in this shortage, university in Medang. And now we are looking also at encouraging other places like other universities to come on board. We're looking at PAU now in the short term, and we're looking at other measures to address this issue. This is a very big issue. Now, we won't have any answers in the near future, the way we are progressing. Unless we grow our economy, we will still have problems with employing more people, number one. Number two, the capacities at our universities are not able to produce that much doctors. So those things are actually being addressed by our government right now. We may not have some answers in the short term, but into the future, possibly if we have some space in the budget, we may look at the proposition that you're putting on the floor of Parliament this morning. One time Islam will also bring him some figures. In terms of nurses, we have about 5,500 nurses, 4,500 nurses in the country. If you look at the ratio for nurse, one nurse is supposed to be attending to less than 10 patients. But in this country, one nurse is attending to over 3,000 people. So health workforce shortage is a big issue in this country. And thank you for raising this point. Hopefully, this government is on track. We are looking at increasing capacity at all our health institutions so that we can produce the number, so that we can make up for the, those people who are leaving the medical field through attrition. And also we have to look at ways to address that issue where, quality, we have to bring up the standards too. Apart from the numbers, the quality of healthcare is so important. So recently there was a visit by the Australian team, and we've raised that point with them, and they're looking at this attachment program that a lot of people like Sepukatemu and a lot of our doctors in the past used to have. And those things are actually being addressed now. So thank you, Governor. I think we probably might not have answers in the near future, but one thing your PHA in Morobe can do, they can do those attachment programs where doctors are actually sent to rural areas to make sure that they provide those services on a consultancy basis, number one. Number two, we are also asking them to come onto the e-medicine platform, where rural doctors can actually, now with the network widely available, they can come on board and do real live consultation with doctors in the major centers. I'm Tasolna, thank you, Drew.